Let's have a look in here. So patient has presented feeling unwell. Yeah, he was saying patient has presented feeling unwell. What do you mean by feeling unwell? What's bothering you? I'm feeling hot and cold. So you speak to the patient, you look at the monitor, blood pressure 100/70, relatively stable. Saturation is normal. Okay. Yeah, saturation is normal. You can see here 97. The heart rate is normal. Temperature is higher. You know, the patient is relatively stable. I can take the whole history, perform all the examination, and then discuss diagnosis and management. So that's what we'll do in here because it's relatively stable. I'll take the whole history. Feeling hot and cold is non-specific symptom. So we're going to be doing a systemic review. Is it the chest, any cough, any shortness of breath? Is it the urine, any urinary problems? Is it the GIT, any diarrhea, vomiting, constipation, abdominal pain? Okay, heart problem, any palpitations? Why is patient not feeling well? Why feeling hot and cold? Is it ear infection? Okay, any ear pain, any discharge? So you're looking for the source of infection because feeling hot and cold. Plus you do the ice, you do the effects of symptoms, you do the PMAF-DOSA. Then you do the examinations. You're going to do all the examinations the same way you do that in Talking Manikin, the other ones. You do examine the chest, examine the abdomen, listen to the heart, look at the stenogenitalia. And when you look at the external in this patient, what you may find, you find the patient has a catheter, and the catheter has a cloudy urine. What does that suggest? Suggest a UTI. Okay, there's a catheter with a cloudy urine, that may suggest a UTI. Okay, now if you see the catheter, then you have to take a history. When was the catheter inserted? Who inserted the catheter? And when is the last time the catheter was changed? When is the last time the urine bag was changed? So it was inserted 6 months ago by the urologist. Okay, inserted 6 months ago by the urologist. I've got your prostate problems. They are planning to perform an operation. The catheter was last changed 3 weeks ago, and the urine bag was changed 3 days ago because I've not been feeling well to change it on a daily basis. Okay, now when you're checking the history, sometimes the patient may not tell you these problems because it's an exam. They want you until you discover the problem, that there is a catheter, then you're going to use it to take a history. They may not volunteer information. Okay, so once you have to finish the examination, of course, you need to examine the lower limbs, check for cellulitis, check for joints problems. Could be septic arthritis, not feeling well. Okay, then you're going to discuss the diagnosis with the patient. Okay, I have examined you now. Okay, his oxygen, remember, is normal. His blood pressure is borderline. So what did you find on examination? So I can say that you're feeling hot and cold. You have a catheter in place. It has got cloudy urine, suggesting you may have some infection. Okay, your blood pressure is on a borderline. That is 100/70. You have got pain in your tummy as well. Okay, there's suprapubic pain because it is a UTI. So I feel that what you may have a sepsis, okay, which is now spreading because your blood pressure is beginning to drop and you're feeling hot and cold generally. Okay, check for the loin as well. There's loin tenderness. So in terms of diagnosis management, so we're going to do some blood testing. Okay, routine blood testing and special blood testing like a blood culture, lactate, ABG. We also need the chest x-ray. We also need the urine culture. Take the urine from your bag and test it for infection. Then your oxygen is okay, so we're not giving you oxygen. Your blood pressure is slightly borderline. I'll give you some fluid. You can do a fluid challenge in here so that you see the blood pressure will go up. Okay, and then you're going to need IV antibiotics because he has got a sepsis, the urine source. Now, wherever there is a sepsis, examiners can give you investigation results, can give you an ABG, can give you lactate. And what do you expect if they give you ABG? There will be what? Acidosis, yeah? There will be metabolic acidosis on the ABG, and the lactate will be high. That would also confirm your diagnosis. As usual, discuss with your seniors for further management. We can use an ABCDE, but if we use the whole history, whole examination, because you are being backed by the what? The observations are relatively stable. The patient is not, I'm dying. So that would also be okay. If you use ABCDE, it is also okay. Now, this is also a stable patient acute limb ischemia, where we do what? We do the history, everything. So if patient is stable, we can do the whole history, and then we do examinations, and then diagnosis and management without following an ABCDE. So that was urosepsis or urine sepsis, a difference nadi.